Can you verify your name and date of birth for me?
Marybeth Weston, 010101.
Excellent. So you're in today for a pre-surgical physical?
I am.
Okay, and it sounds like you're a little nervous about that.
I am.
Okay, you're having a surgery, it looks like, been waiting a while for it.
Yeah, but I never had surgery before.
Okay, I'm gonna need to be right there, so. Never had surgery before, so you're a little nervous about that.
I am, but I'm
Okay.
also nervous about this too.
All these cords here, huh?
Well, and that it might show something that is gonna prevent me from having surgery.
Okay. Well, are you having any chest pain or anything like that?
No.
Any abnormal heartbeats that it feels
Not
like?
that I know of.
Okay.
No.
So typically before surgery, we just do an EKG. It just checks the function of your heart. It's just by putting a bunch of stickers like on your chest, your arms, and your legs. It doesn't hurt. The stickers, the worst part is taking the stickers off. You might get a little bit of a wax job, basically.
Yeah.
But doing the procedure does not hurt at all. Okay.
So those things don't give me shocks?
No. So actually, it records the electrical activity in your heart, but it does not put any electricity into you.
Oh.
Okay.
Okay.
So honestly, most people just lay back, relax. Some will even fall asleep because it honestly takes longer to like set up for the procedure than it does to actually take the picture of your heart.
Oh.
Okay.
Okay.
So we'll make
Are you
sure.
gonna be in the room with me the whole time?
Yep, I'll actually perform the procedure for you.
Oh, okay.
Very quick and easy, and then the doctor will come in and review the results with you. That way you know right away the results, and that way you don't have to wait.
Oh.
That sound good?
Yeah.
Okay.
Yeah, okay. I feel a little better now.
So you have your gown on, everything off underneath the gown,
Yeah,
right?
They told me I had to take my bra off.
Correct,
So-
yep.
Okay.
I do have a blanket for you, that way we can maintain your privacy, keep you warm, because I know it's a
Okay.
little chilly,
Okay.
and that way you feel a little bit more comfortable. Does
Okay.
that sound good?
It does sound good.
So what we'll have you do is, I'm gonna open up the computer system, verify some information with you real quick.
Okay.
Here's the blanket for you, so you can just kind of keep yourself warm and
Okay.
covered, got it?
Yep.
Okay, let's take a peek here. And like I said, we'll just be putting stickers like on your chest and on your arms and legs.
Okay.
That sound okay?
Yeah.
Any trouble with adhesive at all, like
No.
stickers? And I am
Okay.
gonna wipe the area first with an alcohol swab, and that's just to clean the oil off your skin so the stickers stick a little bit better.
Okay.
Okay?
Sure.
Okay, this will take just a second here. I'll log in.
Do you do a lot of these?
Yeah, we do these all day.
Oh, okay.
Yeah, these are really common, especially before you have a surgical procedure. It's really common just to take a picture of your heart to make sure that everything looks okay.
Oh, okay.
Okay? Okay, so I'm gonna put you in our system here. And your first and last name again for me?
So Marybeth?
Maribeth?
Yes.
Okay, and your last name?
Weston with an IN at the end.
Okay, and your date of birth?
010101.
Oh, what a great birthday.
Oh, I know, it's so easy to remember.
And any history of any chest pain you said?
Nope.
No? Okay. And would you say for physical activity, are you very active, sedentary, or very
Active.
Active?
Yep.
Good. And you've never had an EKG before, right?
Correct.
Picture of your
No.
heart? Okay.
No.
And any high blood pressure, high cholesterol, obesity,
Nope.
diabetes?
Nope.
Okay, so overall really healthy, huh?
Yep.
Excellent. Okay, so let's save this in our computer system.
skipping everything else?
Yep.
Okay.
And then we'll do new test. And remember how it pulled up when we did spirometry, any
Mhm.
extra information it would want?
Yeah.
We'll do the same thing, so we're gonna push EKG.
I don't think this one does.
And this one does not, I don't think it does either. Nope. So you'll notice this is the picture of this is the screen. Once we attach these stickers, or put them on, we'll attach these wires to that,
Okay.
okay?
And you said
And
they
then-
don't give me shocks.
They don't, nope.
Okay.
And so it's just, honestly, just taking a quick picture of your heart. It takes a lot longer to set everything up than it does to take the picture,
Okay.
okay?
Okay.
So what I'll do is I'll lay you back here.
So I can
We'll
lay,
get you
I can lay down
comfortable.
now?
Yep, go ahead and lay down. We'll get you nice and comfy here.
Okay.
And honestly, you can just relax. Like I said, this will take a few minutes just to get it set up. There you go. Keep it covered
gosh.
there.
I really can take a nap.
Yeah.
Okay.
So I'm just gonna be wiping the area on your arms and legs, and then I'll wipe the area on your chest, and we'll stick the stickers on there and go from there. Okay. I'm just missing some.
We actually have to take off our shirt.
Everyone can have a gown on. Your privacy will be maintained. I'll show you exactly how to do it so that way nothing is exposed. Okay. So I have my stickers here. You'll want to make sure that you're checking. This is where the lead should be placed. So notice on this machine, the arm leads go on the upper arm. The legs you're gonna put like right in here. Okay. Sound good? Okay. Now you'll have this while you practice. You will not have this during your chest up though. I'm just gonna wipe both of your arms here first.
Okay.
Just gonna go right up here. Sorry, this alcohol might be a little cold.
Oh, that's okay.
And like I said, it's just to make sure that the stickers stick to your arm okay.
Okay.
Now, our the electrodes here, the little flap is where you're gonna be attaching the wire. Which direction do these go when you place them on the body? Up? Down? Which way?
They're downward, aren't they?
So all of them are down except for the
Feet.
legs, and those go up, okay? And I'll show you once I attach the wires why that makes the most sense. So I'm gonna place this one here, little sticker here on your arm, little sticker here on this arm, perfect. And then I'm gonna go down to your legs. I'm gonna pull these up just a little for you,
That's fine. You
okay?
can pull them up as far as you need them.
There you go.
Save alcohol white.
You can, as long as it's wet. Remember, the goal is not to for cleaning, as in making it clean and like you're gonna do an injection, disinfecting. It's cleaning just the oil off the surface of the skin, so the stickers stick a little bit better. And so if it's still wet, you can still use it. Yeah. And again, if you accidentally touch it, it's fine because you're not poking into the skin. It's not a risk for infection. These ones go up. Okay, I'm gonna grab a new one here. I'm going to go ahead and clean your chest off here.
Okay.
First, I'm just gonna clean, so I'm gonna clean in this area and then kind of around this side underneath your breast area and over to the side, okay?
So the
And-
stickers go
Yep.
down here. Okay.
So the stickers are gonna go kind of in the center of your chest here and then kind of down and around over here,
Okay.
okay?
And none on this side though.
So none over there, just on this side over here.
Okay.
Yep. Well, you'll have one, I guess I should say you'll have one, but it'll be toward
Well,
the
right
center
there,
of
but
your
nothing
chest.
down
Yep,
here. Okay.
exactly. So I'm gonna go ahead and open up your gown just enough here so I can see, and I'm just gonna feel a little bit.
Okay.
Because I'm feeling for your ribs and the little spaces in between them, okay?
Okay.
Okay, so I'm gonna clean right here, and I'll go directly across. I'm gonna move this gown just to the side a little. I'm holding it and I'm keeping you covered here.
Okay, you can move it wherever you need to.
Clean in this area. Right in here. All the way over. And I'll end up having you lift your arm up just a little so I can kind of see where your armpit is.
Okay. Will that work?
Yep, that's perfect. I'm just cleaning right now and then we'll go ahead and put the stickers on.
Okay.
Okay, everything's nice and clean. Keep it covered over here. Make sure your gown's gonna stay down.
You're doing a great job keeping me
Oh,
warm.
thank you. I try. I know this is can be a little uncomfortable. Make sure my stickers don't fall.
Does the chest one go up or down?
Facing down, all down except for the legs. Okay. So right now I'm gonna start feeling for where our electrodes go. What is the first one gonna be? Where's V1?
Fourth intercostal.
Wow, that was like in sync. I like it. Fourth intercostal space. 2, 3. And I kind of walk my way down so you can feel there.
And if you guys want to come up and see how she walks her
Yep.
way down.
So come on up so you can see. So I will feel for that space. And then I kind of rock back and forth so I can feel where the bone is, which is the bump, and then where that next little space is. So 1, 2, and I can kind of rock back and forth and feel it. 3 is right here, and then 4 is right here.
See how she walked her way down?
Now, fourth intercostal space on the right side. Directly across it, fourth intercostal space on the left side is gonna be V2, right? Stickers are stuck to one another. You wanna make sure you get off of the sternum, okay? So then which one do I go to? I did V1 and V2. V4, right? Cause remember you skipped 3. So fourth, V4 goes where?
It goes underneath here.
How do we know how far over to go?
The collarbone.
Collarbone, we do mid-clavicular, right? Middle of the clavicle. So I'm gonna feel her clavicle, and sometimes you even can look at the clavicle. And you're gonna go middle. So middle of the clavicle's here, it's gonna go straight down. And what I like to do is I kinda like to use the gown to kind of move the breast, and that way it's out of the way. Also, so you know where you can go. So here's 4. 5 would be like right there, but that's gonna be in the crease of the breast. So would we go above it or below it?
Below
Right below it, right? So I'm gonna take this one, see where the middle of her clavicle is. I'm gonna go right there, okay? Then what I'm gonna do is I'm gonna use the gown to create a straight line because V3 goes where? Yep, straight between. Do you mind stepping to the side? We're videoing.
You want me
Thank
to just
you.
pick it up?
Yeah, if you can, that'd be great.
Because I don't think they can see.
Otherwise, you could stand right here.
Okay.
Madison.
Oh.
Oh, that's okay.
That way you can still move closer.
So, we've got V2 here, right? We're going to use the gown to create a straight line between V2 and V4. V3 is going to go right in between those, okay? So I'm going to go right in between those, and I'm going to go right there. Is that between? Need to go a little bit. I'm going to move this one. Sorry, it's going to be a little.
Oh, that didn't hurt at all.
Okay, good. There we go. Right in between, straight line. Okay. Now I'm going to go to which one next? V6, right? Which is where?
the armpit.
Mid-axillary, same horizontal plane, right? Meaning it's straight over from V4. So I'm going to use the gown again. The gown's like my best friend here now. And use this as a straight line over to mid-axillary. So I'm going to kind of look up where her armpit is. And I'm going to go straight across. Straight. Notice same horizontal plane. So V6 is in place. Now I can do V5, which is directly
in between.
in between those two, right? Okay, so all my stickers are on now. My electrodes are on. Okay, now I'm going to go ahead and start hooking up my wires. Is it okay if I place this on your chest here or on your belly? Okay, perfect. So what I'm going to do is get all these wires hooked up now. Okay, question. It mattered which order I put the stickers on, the electrodes on, right? Does it matter which order I put these on? As long as I attach it to the correct electrode, it does not matter which order I put them in. Does that make sense? So if I want to start with the arms and legs, I can start with the arms and legs. If I wanted to start with the chest, I can start with the chest. You'll notice on here they're labeled. LA would be
Left arm.
left arm, right? So I'm actually going to flip this over so the left side is on the left side. The right will be on the right side. You want to try to avoid getting the wires all twisted. It will happen though. There's a lot of wires. So LL is left leg, right? Now, if this sticker was pointing down, what would happen to this electrode?
It'd be reading the foot.
It would be, no, it wouldn't be reading the foot, but think about if this sticker was down here and I was clipping this to this end.
It might be twisted.
It's going to try to pull up on that, right? So it makes most sense to have this pointing up. That way the wire can just be nice and smooth.
Straight.
Yep, straight. Okay, this one's going on the left arm. Now I can go to the right side. We have right leg. These little blue tabs, be very careful when you pull them up to open it, and then push it down. Hook this one to your arm. Make sure your gown isn't in there. There we go. Okay. And then I'm going to go ahead and start putting the chest ones on. One, 2, and 3. I'm gonna sneak right beside you. Sorry,
You were right. It does take a long time to set it up.
I
doesn't
told
it?
you, and you'll be surprised how quickly it's like done.
Really?
Yeah, it's way more work to set it up and take the picture than it is to actually take the picture. There's 1. 2. Covered here. Three. Four. 5 and oh, sorry.
Oh, it didn't even
Yeah.
hurt.
My hand got stuck on it. 6. So then before I even start looking at that, I'm going to recheck all of my electrodes, make sure they have good placement and contact with the patient's skin. Looks good. Good. Okay, so I'll just need you to relax, hold still, and we'll try to get a good picture here, okay? Okay, so how does this look right now? How's the baseline?
Good.
Level.
Pretty good, except for,
Oh, yeah.
see this? So I'm gonna recheck the leg and the left arm. This one's pulling a little bit, so I'm just gonna try to get this down flat. It's got good contact. Okay. It's because I was touching it. You want to give it a second so this entire line gets a good picture. 3 is just not giving me a good picture.
Could it be from my watch, maybe?
It could be. We can try to take that off and see if it would.
Maybe. It's a smartwatch.
It
so
very well could be then. Let's try to take that off. I'm
Okay.
going to set it right up here if that's okay.
That's fine.
Okay. Right there. Let's see how that does. Notice how they all went. It's looking a little better. Just a second. Okay, so we're gonna go ahead and once you're comfortable with it and like what you see, it's still not
It's
great.
still, yeah, it's still low right there.
And sometimes it's just because I'm gonna put this on here. This one I don't really like.
Maybe
Do
take
you mind lifting your hand up? There we go.
Sure, maybe take the electrode and put it towards the outer part of my arm. I know sometimes that helps when I've done it with other ones.
Sorry, I'm gonna pull this
Oh,
up.
no, that's okay.
Just gonna move this to see if we get a little bit better picture.
Okay.
These cell phones or like electronic devices interfere with it?
Yep, remember that AC
Okay.
interference?
So, great. Does she have a phone on her?
No,
No?
it's still ABL and, well, even one.
Your
You know,
smartwatch.
it's honestly I think it's just honestly these stickers
It
are.
could be.
I don't have a smartwatch. I get ran
Okay.
over in the parking lot.
So your goal is that you want the clearest kind of crisp baseline there. 3 is just not great, but we're gonna kind of go with it, I think, because I've rechecked my electrodes, I've rechecked the actual placement and the contact with the patient's skin. So what I'm gonna do is I'm gonna push acquire in the top. Sinus rhythm, occasional ectopic ventricular beat within normal limits. So I would print this out and provide it to the doctor.
Does
I'm
that
gonna
mean
tell-
I can't have my surgery?
I'm going to have the doctor come in and review the results with you. I'm
Oh.
going to make sure this picture is a good picture that he's okay with.
Okay.
So I'm going to leave you all hooked up until I review it with the doctor. That way we don't have to go through that whole process again if he
Okay.
wants a different picture.
Okay.
That sound good?
Yeah.
So then you would bring that to the doctor, come back in. Okay, the doctor said he's going to be right in to review. I can go ahead and get you unhooked, okay?
Okay.
Do you want to take the stickers off or do you want me to?
I can take the stickers off.
Okay. I'll
You'll
just
take these
unhook
little
you.
wires off, right?
Yep, that's what I'm
Okay.
going to do right now.
Okay.
And I told you it's quicker. Just
It was.
It takes longer to do that, like set this all up, than it does to take the picture, huh?
That was crazy. It took like 30 seconds to take the picture.
Yep.
You guys
I
want
see
me
the
to end it?
placement for
Yeah.
the stickers.